Hi, MadP.
Hi, Dr. K.
How are you today?
Okay.
All right. It's good to see you after your exam, but you're here pretty soon after, so let me know what's going on.
I'm having some itchiness on the scalp.
Okay.
On my head area. It's mostly in the back, but I would say kind of all over as well.
Okay, itchiness. How do you inspect your skin in the mirror? Do you notice any specific red bumps, or is it inflamed?
Very hard to visualize.
Okay. Well, that's what I'll be doing today. And you said it's all throughout. Is this persisting throughout the day, any certain times of day, or after you eat certain foods?
Honestly, it is after I eat food. Yeah, so
Okay.
after I have breakfast or any other meal.
Okay, so it could be a digestionally triggered situation here. So it's itchiness in the scalp.
I'm having some pain in my stomach too, and
Okay.
some itchiness sometimes on
Okay.
the skin.
Okay. Is your stomach tender to the touch, would you say?
No.
Okay, so it really is more an internal pain?
Yeah.
All right, and on a scale of 1 to 10, how would you rate it?
It's about a 3.
Okay. So are you on any special diets?
No.
No special diets? Any medication on a daily basis that you're taking?
No.
Okay, and can you confirm your date of birth?
June 2nd, 89.
Okay. Any family history that I should be aware of?
No, I don't think so.
Okay. Surgeries in the last year?
No.
Okay. And any traumatic events happening to you in the past month whenever this pain started? Sometimes it can be a psychologically based issue, especially when there's pain both in the stomach and the head.
No.
No? Okay, so I'll be taking a look for sure. All right, so I'm going to start with your vitals, okay? Go ahead and relax and breathe normally. Okay. Heartbeat sounds normal. I'm going to listen on the bell side. No murmurs present. So continue to breathe normally. I'm just going to be listening to your chest for signs of congestion and fluid buildup. Okay. All right, everything sounds perfectly healthy. I'm going to listen to your lungs. So take a deep breath in for me. In, 2, 3. And out. 2, 3. Good. In, 2, 3. And out. 2, 3. Let's repeat that once more on this side. In, 2, 3. And out. 2, 3. All right, I'll be taking your blood pressure. Do you have another preference?
No.
Okay, I'm going to go ahead and use this one. Could you hold this for me? Thank you. Okay. Okay, 119/78. That's perfect. I'm going to go ahead and slide this off. Okay. I'm going to take your oxygenation and temperature, so can I have your index finger? Thank you. Okay. And cross your legs for me, please. Thank you. Okay. You are at 99% at room air, and your heart rate is 95. It's a little high. Okay. Just going to be taking a look at the skin on your face and examining, also doing some palpations. Your skin looks very well perfused. I'm not seeing any signs of irritation here, but I do see a bit of redness along the scalp. Very inflamed. Okay. Okay. Definitely some redness. I'm seeing a bit of swelling too on top of the head, so that's definitely something that might be a cause of concern. I'm going to do a sharp and dull test because sometimes these issues can stem from the neurons in the face, and we just want to rule that out. That it's not a cranial nerve issue, and that it is a skin issue. So just keep your eyes closed. Do you feel this?
Yes.
That's going to be a sharp sensation. Do you feel this?
Yes.
That will be dull. So let me know which one you feel and keep your eyes closed.
Dull.
Good.
Sharp. Dull. Sharp. Dull. 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 Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. 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 Sharp. Dull. Sharp.
Good. Keep your eyes closed. I'm just feeling your lymph nodes are non-palpable. On your scalp, you say you feel itchiness, but do you feel any pain, any soreness whenever I touch, say here?
No.
Okay, so it's just itchy. All right, we'll be testing for fluid buildup. Do some percussions. I am noticing some edema along the scalp. Okay. Let me know if you feel the sensation equally on both sides of the face. It's going to be starting at the nose and ending right at the ear. Let me know if any of that feels blunted to you or if you can't feel it. Do you feel it?
Yes.
Okay. going to take a look inside your eyes and ears, and then we'll go ahead and do the scalp exam. So go ahead. Okay, your pupils are round and reactive. I don't see any jaundice or excess veinage. The moisture level is in the normal range. Go ahead and look straight ahead for me. Okay, same here. I'm not worried about that. Look straight ahead for me. I'm just going to look inside. Just make sure that there's no inflammation here. Okay. Tympanic membrane is gray and moist. No scarring or scratching. Ears look to be in good shape. Same thing here. Very good. Some slight wax buildup, but nothing abnormal. If you've been having any vision or hearing problems, I'd be happy to do some extensive tests on that, but if not, I'd love to start checking up on your scalp.
Okay.
Okay? I'm just going to start with an in-depth examination of the skin. I'm seeing some patches of redness that are specifically inflamed. Your hair follicles look healthy, but it seems to be a dermatological issue. P, do you remember changing any shampoos or using conditioners in the last month?
I've been traveling a lot.
Okay.
And yeah, my shampoo, the brand that I usually use wasn't able to get from the store, so I had to use whatever was available.
Okay. And so usually issues with scalp allergies to topical products that'll go away within 48 hours after discontinuation of use. If you've been using the same product each day, that can really build up. And if you've been using it for a while, even after you stop, it can really cause irritation and take some more time to heal. Okay. I'm going to do a sensitivity test, okay? This is going to feel like a cold sensation, and this will feel warm, okay? Let me know which one you feel.
Cold. Warm. Cold. 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 Warm.
Good.
Cold. 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 Cold.
You feel no pressure at all here?
I can feel the pressure, yeah.
Okay. Does it feel cold or warm to you?
Maybe warm.
Good.
Warm.
Good.
Warm.
Okay.
Cold.
Good. Okay. I'm going to be using a couple different brushes just to get a better range. Okay. Going to be looking at different sections of the scalp, so as I bring this down along the top of your head, do you feel it all the way? Say yes or no. I'm going to be going from here to here, so both sides of the crown.
Yes.
Okay.
No.
Okay. Going down to the ear, let me know if you feel it all the way, and that would be on your right side.
Yes. Yes.
Okay. Going to the left. Okay, definitely some numbness there. So as I bring this instrument to from the crown of your head to the tip, I want you to let me know if you feel it all the way. Say yes or no again.
Yes. 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 Yes.
Okay. Going to be taking a sample of the scalp, so this should just feel very light, like a light tickle. Okay. going to be applying 2 different pressure points to your scalp. Let me know if you feel 1 or 2. This is going to be a lot lighter than the traditional test, so I just want to gauge and see how much you can feel here. This will be 1, and this will be 2. Let me know which one you feel. Say 1 or 2.
2. 2. 1. 1. 1. 1. 2. 2. 2. 1. 1. 1. 1. 1. 1.
Okay.
1. 1. 1.
Okay. Definitely some sensory blunting. I'm just going to be collecting some more samples, so just relax. Okay. I'm going to do a sharp and dull test. Let me know which one you feel, okay? So this will be sharp. This will be dull. Do you feel both?
Yes.
Okay, so say sharp or dull.
Dull. Sharp. 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 Dull. 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 Sharp. 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 Dull. Dull. Sharp. Dull.
Okay. So we're going to do one more test before we move on to your stomach. This is going to be a cold sensation, And this will be crinkle. So go ahead and say cold or crinkle. This is just to test the variety of sensations that you can feel.
Cold. Crinkle. Cold. Crinkle. Crinkle. Cold. Cold. Crinkle. 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 Cold. Crinkle. Cold. Crinkle.
Yes.
Cold.
Good.
Cold. Cold. Crinkle. 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 Cold. 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 Crinkle. Crinkle.
Okay, very good. So I'm not seeing a complete loss of sensitivity in the scalp, but there are definitely some areas that, because of the itching and inflammation, you were not able to determine those senses. So it's definitely something to be concerned about. We'll talk about that later. I'm going to go ahead and look at your stomach, okay?
Okay.
Okay, MadP, with your permission, I'm just going to lift your shirt up and just so I can get a look at the abdomen, and then eventually I'll be pulling down these shorts just a little bit more so I can get access to your lymph nodes, okay? Is that all right?
Yes.
Okay, but for now I'm just going to be palpating. Let me know if you feel any pain.
Yeah, some pain there.
Right there. So when you have your stomach pain, is it more on this left side?
It's on the right side
The right?
as well.
Okay, so it's kind of all, okay. So this is going to be a little painful, but I just need to check the size of your organs, so I apologize. I will be brief. Okay. Okay, gonna go a little lower like I said. Okay. All right. Normal size lymph nodes. I'm gonna go ahead and listen. It's gonna feel like a little cold pressure. I'm not sensing any abnormal fluid buildup or stomach acidity. All sounds seem pretty consistent. I can see the skin on your stomach. It looks very healthy. I don't see any inflammation. I don't see any redness or itchiness like I saw on the scalp, so that's good. Seems like you may have two different problems. One, skin and perhaps neurological problem in the head, and then something with your digestion, and I don't think that they're related. I'm just going to do some quick percussions. This is going to be a sharp sensation, and this will be dull. Let me know which one you feel, okay?
Okay. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Dull.
Okay. I'm pretty pleased with that. One more temperature test. So this will be cold. This will be warm. Let me know which one you feel, okay?
Warm. Cold. Warm. Cold. Warm. Warm. Cold. 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 Warm. Cold. Warm. Warm. Cold. 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 Cold.
Okay. No issues there, MadP. So what I'm going to do with a few appointments with specialists, I think you need to see you need to have a test done on your head. You need a CT scan to make sure there are no neurological issues. I also want to send you to see a dermatologist because it does sound like an extremely irritated reaction to perhaps the shampoo or something else in your home. I'm not quite able to determine what it is, but I think a specialist would better help with that. I also want to just set up a telehealth call with a dietitian just to discuss your regular diet and see what could be causing those digestion issues. I did a series of tests here on your organs and your sensory tests in your stomach to rule out anything serious, and I did rule out anything serious. So I really do think it's a question of diet, okay?
Okay.
All right. So on your own time, I'm going to have you just get up and we'll meet you in the front, set up those appointments, and thank you for allowing me to do this exam.
Thank you.
Do you have any questions?
No.
Okay.